Hello, everyone, and a huge warm welcome to the second annual HPN Allied Health Virtual Career Day. My name is Dan Olson. My background is I am a medical laboratory scientist, and I have the honor of serving as the president of Health Professions Network, HPN. And on behalf of HPN, we're absolutely thrilled to have you join us today, whether you're a bright, curious student exploring your future, a dedicated faculty member supporting the next generation, or one of our incredible allied health professionals and partners who have taken the time to share your expertise. Last year's event was such a success, and this year we put together an even more engaging day dedicated to showcasing the diverse and rewarding careers within allied health. Over the next 60 minutes, this virtual event gives you an invaluable opportunity to directly engage with active professionals who are shaping the healthcare landscape today. This year, we've put together an even more engaging day dedicated to showcasing the diverse and rewarding careers within allied health. Our goal is to connect your potential with real-world experience, empowering you to take the next step in your professional journey. Get ready to explore, connect, and be inspired. Thank you for being here. Okay, let's get started.
Hi, everybody. My name is Kirsty Fields, and I'm a board certified dermatology physician assistant or physician associate, depending on what state that you're practicing in. So, what is a PA? A PA is a licensed and highly specialized healthcare provider that works with a team of other healthcare providers, specifically under the supervision of a doctor or board certified physician. And a little bit about my day-to-day life, since I am in dermatology, that means I get to see all things related to the skin. So I'm seeing acne, eczema, psoriasis, vitiligo, hair loss, skin cancers, the list goes on and on and on. But specifically, what I have the privilege of doing is sitting down and individualizing my care to each and every one of my patients that sits across the room in front of me. I get to diagnose and treat various illnesses. I get to order and interpret lab work and imaging. I get to perform various procedures in the office or even perform or assist in surgeries if need be. And one of the beauties about the PA profession is that we have lateral mobility. So one day if I want to work in emergency medicine, pediatrics, general surgery, I can do so because I'm licensed and credentialed to do so. And prior to getting this job as a PA, I had to go through about 2.5 years of PA school. And to be eligible to apply for PA school, you do have to complete some prerequisites, as well as have a bachelor's degree from a 4-year program. And if you are interested in learning more about the requirements to becoming a PA and getting into your respective school, I highly recommend a free online resource. It is called CASPA, that is CASPA, and that will definitely outline your journey to becoming a PA if you are interested. And just remember that some PA schools vary in length of time. So my schooling was 2.5 years. Some may be a little bit under that, and some might be more than that. It all depends. But I hope this helps. I hope you learn more about what I do. And as always, if you have any questions, feel free to reach out. My name is Kirsty. It was so nice to tell you about my profession as a PA. I love what I do and I wouldn't trade it for the world. Hope you have a great day. Bye.
Do you love science? Does the human body fascinate you? Have you considered a medical laboratory career? We asked medical laboratory professionals, what do you love about your career? This is what they said.
Hi, my name is Dave Karen. I'm the Medical Director of Clinical Pathology at the University of Michigan, and I can hardly wait to get to work every day. And I get to work with some wonderful people too.
What I love about my job is solving puzzles. Every day there's a new puzzle.
This is where you can see science meets medicine.
I like math and science, and I fell into this career, and I love it because it's ever changing and it's always interesting.
It provides me with career opportunity with very challenges and very rewarding at the same time. Hi, I'm Suzanne Butch, and for 40 years I was in the blood bank and transfusion service, and now I'm in the Department of Healthcare and Quality Improvement. Now, what do I love about my career? It changes all the time. If you look back over those 40 years, you'll see even in blood banking there's innovation and change and automation. What a wonderful career.
I really enjoy learning the new techniques and new technologies and testing platforms that are constantly coming into the clinical laboratory. And finally, I really enjoy mentoring students and creating the future medical laboratory professionals that will become my colleagues one day.
We have fun, we love what we're doing, and we help people. What could be a better job?
Next up, we will be discussing physical therapy. And I have here today with me, Amy Schubert.
Hi, thanks so much for having me. My name is Amy Schubert. I am trained as a physical therapist and worked as a PT for many years, primarily in the area of sports medicine. But then I did have my own private practice for a few years prior to coming on board as more of an administrative position as the director of admissions for University of Wisconsin-Madison's DPT program.
Wonderful. And so can you provide a brief overview of the profession and your primary responsibilities?
Absolutely. So PTs are all about movement. So they are really movement experts. They are trained as licensed doctors of physical therapy who are trained to examine patients and then come up with a diagnosis and treatment for movement dysfunction. They help people who are impacted by diseases, injuries, disabilities. They sometimes help with prevention of movement loss and promotion of wellness. And they use exercises like therapeutic exercises that are prescribed along with various modalities, sometimes assistive devices like crutches, walkers, canes, things like that. Hands-on care, so sometimes manual therapy, a lot of patient education, and evidence-based research to treat patients.
So if you could tell me a little bit about how someone becomes a physical therapist, what educational background and training are typically required to enter the field?
Absolutely. So as I mentioned, the physical therapy profession is now a doctoring level profession. So there's a doctorate of physical therapy or DPT degree. And what happens is a student completes their high school years and then college, so getting a bachelor's degree or undergraduate degree in some area of study while taking prerequisite courses that are required for PT schools. These are pretty consistent throughout all programs across the country. So things like biology, chemistry, physics, anatomy, physiology, sometimes psychology, but again, a lot of consistency in those courses. And then you apply to a DPT program, and that program is then 3 years long. And upon graduation, you sit for a national boards exam. When you pass the exam, you can then apply for a license to be to practice physical therapy in whatever state that you plan to live and practice in.
Wonderful. And can you share any insights into the typical salary ranges for professionals in your field?
Yeah, so salary can really vary greatly between where someone lives, so geographically across the United States, what area they practice in, so the type of specialty, also how much experience they have. So, there's a lot of things that can kind of vary this. There's data recently that came out that indicates kind of all those things aside, average salary for PTs is just over $91,000. And the range is anywhere from 75,000 to around 106,000.
Thank you. And so you mentioned this previously, but can you talk a little bit more about the common work settings for professionals in your field?
Yeah, so again, PTs are really all about movement. So anything that you can think of, any patient population or setting where people are moving in, which is everywhere, right? So the most common ones that people think of are things like outpatient clinics. Sometimes those are affiliated with a hospital-based network. Sometimes they're like private practice outpatient clinics. People also often think of hospitals and nursing homes, but there's also places like schools. So PTs help kiddos in schools who are maybe unable to participate like their peers to get from class to class or participate in PE and things like that. So PTs are in schools to help with that. They are also in home health settings. So when patients are discharged home, maybe from a hospital or nursing facility, but still need some kind of therapy and are unable to leave their home, or it's really difficult for them to leave their home to go to a clinic, a PT can come into the home setting. There's also things like sports and fitness kind of facilities and teams. There can be corporate offices. So doing things maybe like industrial type of PT like in a workplace. The military setting also has PT. There are PTs that are involved in like public health type things. So lots and lots of places that we're plugged into.
The last question is there an interesting or lesser known fact about your profession that you think that people might find intriguing or surprising?
Yeah, so I think one thing that is really surprising to people, so PTs treat multiple body systems, and oftentimes people they most commonly think of things like the musculoskeletal system. So they think of, sprains, strains, breaks, pain, things like that. Sometimes they'll think of the nervous system and people that we see who maybe have had a stroke, spinal cord injury, traumatic brain injury, things like that. But we also see patients with cardiopulmonary type conditions, so heart, lung conditions, who again, those conditions impact their ability to move. But one that I think is most interesting and the least well known is that PTs can see patients with integumentary problems, so skin types of issues. So actually, our skin is the largest organ that we have, and out of all of our organs in our whole body. And PTs are really a key player in helping with wound management. So whether that be from maybe sores from a patient who has diabetes, or someone who has really significant burns or something like that, we do a lot of treatment because, as you can imagine, our skin needs to be really mobile as we're allowed to move in various directions and planes of movement. And if we have something that's restricting the mobility of the skin, it is really impactful in movement. So I think that's probably one of the most interesting things that people don't think about when they think of PT.
Well, thank you, Amy. I definitely learned lots about physical therapy today that I did not know. And that interesting fact was truly interesting. Thank you for your time today.
Thank you for having me.
Hello, my name is Alyssa Dorado. I am a board certified music therapist currently based out of Fishers, Indiana, where I've been practicing for over 5 years. Music therapy is the clinical and evidence-based use of music to support somebody on their individualized goals. For me, I support people with intellectual and developmental disabilities. So we're working on cognitive, social, emotional, communication, and gross motor, fine motor outcomes. But you can find music therapy in so many different areas, whether that's inside of a hospital, mental health facilities, hospice and bereavement, within school systems. The opportunities are endless. In order to become a music therapist, you need to finish a 4-year certified degree in music therapy from one of over 70 programs across the United States. Then you will finish a 6-month internship where you're going to get to do music therapy every single day with the supervision of a board certified music therapist, and then be able to sit for your board exams. What is nice as a music therapist is you get to work on similar goals and work hand in hand with other people on the interdisciplinary team. Our day-to-day lives look different depending on where you work. For me, I'm in clinic 3 days a week. Music therapy is able to provide an individualized approach to the people that we support. So if somebody really loves country music or really loves rock and roll, we can really individualize our sessions to make music beneficial, because music impacts everybody differently. And being able to understand how music impacts the body when providing this as a service is so important. If music therapy is something you believe is something that could be your future career, I recommend going to the American Music Therapy Association and your state organization websites to be able to learn more, better understand what music therapy is, and find the college program that is right for you to start your life as a music therapist.
Interested in a career in medicine and ready to set out on the path? You want to help patients, but the cost and commitment to med school is turning you away from your true calling, helping others. There are so many amazing careers, but most of them are hidden behind the generic and popular few we already know.
I graduated with a degree in biology, unsure kind of what to do, originally planning to go to medical or dental school. And that just halfway through undergrad decided I didn't want to do that. I was interested in medical imaging and radiology. Went and did some research and shadowed and just kind of fell in love with it and enrolled in the program, and here we are.
Just like superheroes see through walls or track microscopic invaders, there are squads of specifically trained nuclear medicine professionals who use small doses of radioactive drugs and high-level imaging equipment to augment the human eye. They can look through the body to diagnose and treat disease. Nuclear medicine technologists are recognized as integral partners within the medical healthcare team.
I started in nuclear medicine probably 22 years ago, and I fell in love with it because we were able to look at the physiology of what was going on in the body as opposed to just the anatomical details that you got from a CT or X-ray. So I fell in love with the physiology behind it.
I chose nuclear medicine based on the diversity of what you could do in the career field. There are many opportunities as a staff person coming in at entry level, from educator to management to research. The industry is so big, and I thought that was the perfect opportunity to expand my career.
My experience was a little different because I'm in the military at the time. So we have a career ladder. Started off as a staff technologist, and then I moved up to managing the department. And then from there, I went on to becoming the program director of the nuclear medicine program.
Careers in nuclear medicine are medicine's best kept secret, with numerous paths from physicians and technologists who help with patient diagnosis to pharmacists who prepare and test radiopharmaceuticals used in treatments, or even physicists and engineers who get into the nitty-gritty of nuclear science. There is something out there for everyone passionate about helping others. There is currently a huge demand for nuclear medicine technologists, with other areas of the field following close behind.
Some of the hardest parts are the fact that you're seeing sick people. You get relationships with people over time, and then in PET imaging, we oftentimes see what we call frequent flyers, so patients that are coming to us every couple of months to get evaluated. You develop relationships with these folks. You start to love them as your own, and so in many cases, you get to see them heal and you get to see them go home with a smile, and at times you lose your family members, you lose your patients, and that's always been a hard part for me.
You have to be able to win and gain the trust of your patients, and in doing so, you have to be willing to listen to their story, let them tell their story, and be available to them at all times. The career advancement is fantastic, but it really is about the patients. Being able to deliver personalized precision medicine to patients that they deserve and need is really what it's all about.
It's just a really exciting time. We are advancing precision medicine quite rapidly, and to be able to see that firsthand is amazing.
take little bits and pieces away from people that are educating you and make them your own. Dive in with just both feet and to learn and absorb as much as you can.
Finding where to begin your career is one of the most important decisions in a person's life. But with seemingly endless options at every turn, it's common to get hit with career block. You don't want to get caught in the career trap. Get into a stable career with lots of room for growth. Find out more about how you can begin a career as a nuclear medicine technologist at snmmi.org.
Hi everyone, my name is Dr. Renee Raymond. I am a clinical and counseling psychologist who specializes in the area of sport and performance psychology. Just a little bit about me and my journey. So my journey is what I would deem very non-traditional. I started out in kinesiology and I did my undergraduate degree in kinesiology and health sciences, and I minored in psychology. And then through a lot of twists and turns and just wanting to do more in the area of health, I was planning on going back to school to become a physiotherapist and ended up getting a job and learning about the field of psychotherapy. So I went back and I did my master's in clinical psychology through Walden University, and I started practicing as a psychotherapist where I was able to hone a lot of my skills in mental health, which has been immensely helpful in the field of sports psychology because not everything is a performance issue. Sometimes it's very personal. Sometimes it's familial issues. And so I practiced as a psychotherapist for a number of years. And with my background in kinesiology, and I had been a martial artist in Taekwondo, I started attracting a lot of athletes. So through many different points of reflection and wanting to, again, enhance my skills, I decided to go back and do my doctorate in psychology, which I completed with California Southern University last year. And I also did a postgraduate certificate in sports psychology. Now I work, a typical day for me is I work with a professional soccer team, York United FC, here in Toronto, Canada. It's a Premier League team, Canadian Premier League team. And then I also work as a contractor with the Canadian Olympic Committee's game plan program. So I see typically a number of Olympic athletes, also professional athletes, some non-athletes as well. Through my private practice. So I could be doing anything from mental performance work to sports psychology work to more clinical psychology work. With my journey, one thing that I would say, and my best piece of advice to this generation is don't count yourself out. Most people, when you look at their journey, it is not just a straight path. I think it's very helpful when you have some opportunity to try some things in your field, talk to others, network. Even if you work in a completely different field or you're not sure what you want to do, just allowing yourself to get out there and talk to people. And if you decide that you want to move in a new direction, especially in healthcare, to go for it. If you asked me even 3 years ago if I'd be doing what I'm doing, I probably would not have said anything close to it. And so my life has taken me in this journey, and I've been learning about what I enjoy doing for work, but also allowing myself to experience what it's like to work in sport and be amazed by it and inspired to do more. So I just encourage you just to speak to everyone that you can, learn as much as you can, stay humble, and go for your dreams.
Hi, my name is Jackie Esselton, and I'm a registered dental hygienist. That is my first degree, and I decided to go ahead and get a degree from a four-year university and do the bachelor's option. I just wanted you to know you can do the associate's degree option for dental hygiene, and that's great too. You get paid the same whether you have an associate's degree or a bachelor's degree. And I chose the bachelor's because I knew I wanted to continue education and possibly be an instructor someday in a dental hygiene program. Kind of what my goal was when I started out. So I worked as a dental hygienist for 14 years. And let me give you some of the highlights of the career. The flexibility for your days of the week that you want to work, even your hours, can be pretty flexible. So that's one of the, I think, big draw to the career. The pay is really great. Some offices offer benefits and some really it's just straight pay and you kind of have to work on your own retirement and your own benefits. But full-time employment does usually include benefits and vacation, insurance, 401k, and all those good things that you want to look into. But I really enjoyed the flexibility with my family and being able to take some time off, but just go right back to it without too much trouble. So the next thing, the degree is heavily science-based, not as much math, a little math, algebra, but mostly anatomy and physiology and chemistry and biology and microbiology and things like that. So I really enjoyed sciences. If you like science classes, you'll enjoy the classes that you take for the dental hygiene degree. The technical skills that you'll need include good dexterity. You do use your non-dominant hand about as often as you use your dominant hand, but over time, you really do develop, even if you don't think your left hand is as strong as your right, for example, over time, you really do get build up that muscle memory to be able to use both your hands to do a lot of your skills. Being able to communicate well with patients is another technical, very good skill you kind of have to possess. You are an educator. You're just educating one patient at a time, or you're educating the pediatric patient's parents about what they need to do to improve their oral health. Or individually, you work with seniors, you work with people with special needs. You have all kinds of different types of patients, so you have to adjust your teaching style to fit their learning style, so to speak. So it's a very heavily patient education career. You're teaching and talking and sharing how to improve their health with every patient. So you do a lot of talking, and so kind of have to be comfortable visiting with people one-on-one, which is not bad, and people are super sweet. So I think you'll enjoy the career, and I think there's a lot of room for growth afterwards. So I do encourage you to go ahead and get that bachelor's in something as well over time, so that if you want to be an instructor. I did teach at Austin Community College for just a while, teaching medical terminology, and I was planning to work in their their dental hygiene program, but I ended up teaching health science in high school. And that's where I found my love for teaching, and I was able to use my career to launch that second career. All right. This is a little bit about dental hygiene. I enjoyed every bit of it. It has been a great starting point, and it can be a continuously great career for your entire life. All right. Thank you very much for listening, and I hope dental is in your future. It's really where some of the best job security is. I promise you, dentists are looking for hygienists everywhere right now. You really can find your job situation and customize it to your needs with no problem. All right. Thank you.
Hi, my name is Frankie. I'm a certified physician assistant. I work in trauma, critical care, and acute care surgery. I'm a part of a dynamic team that's made up of fellow PAs, NPs, and trauma surgeons. Together, we manage patients across the whole hospital, whether that be in the emergency department, ICU, the intensive care unit, or the regular nursing floor. My daily responsibilities include rounding on the patients that are admitted to our service, responding to trauma activations, as well as seeing consults down in the ED. One aspect that I enjoy about my specialty is that no 2 days are ever the same. I also appreciate the opportunity to practice at the top of my license, which includes doing procedures such as arterial lines, chest tube placement, central lines, laceration repairs, and much more. What drew me to this specialty is really also the continuity of care. This meaning that I get to see the patient from when they come into the emergency department, whether they're a consult or trauma activation, all the way to when they're discharged. Another great part about my team is that we're very collaborative, and so I get to pull on the experience of fellow PAs and surgeons that give me a great team-based way to care for a patient and continue learning. This field continuously keeps me learning and challenges me daily. Each day brings something new, whether it's a unique case or a procedure that I've never gotten to see before. That's just a little bit about my job and what the day-to-day includes in being a trauma, critical care, and acute care surgery PA. But in general, being a PA gives me a unique opportunity to care and treat for patients at a high level, as well as giving me the flexibility to be able to change specialties if that's something that I desire. The adaptability that comes with being a PA is one of the greatest strengths that's involved in this profession. I know that was pretty quick and you probably have a few questions, so if you have any questions or need any help with whether you want to be a trauma PA or just a PA in general, feel free to reach out and I'll be here to help.
When you go to the hospital, you know you will have nursing staff and physicians providing care. What you may not realize is that there is another member of the healthcare team who takes part in your care behind the scenes, the Health Unit Coordinator. An HUC handles the administrative duties of a single section of a hospital or clinic. They are highly organized people who aid in customer service, coordination of a health unit, and management of physician orders. They work anywhere patient care is delivered, like hospitals and extended care facilities. The HUC acts as the communication liaison between all departments in a healthcare facility, including nurses, physicians, other professional staff, ancillary staff, patients, and visitors. They are expected to know where everyone is at all times and to anticipate the needs of staff and patients, booking procedures and transport, ordering supplies and equipment, making sure testing is done, and maintaining confidential medical records are all aspects of the HUC role. Like the hub and a wheel, the abilities of the Health Unit Coordinator help the department spin more effectively, which results in better patient care. More details about the responsibility of the Health Unit Coordinator can be found in the certification content outline. The 4 major categories are order management, coordination of the unit, customer service, and professional development. The HUC has excellent people skills and is proficient in dealing with grieving families, de-escalating tense situations, and advocating for families and visitors. Health Unit Coordinating requires a manageable investment in education. HUC education ranges from on-the-job training to associate degrees. Most common are certificate programs at community colleges, either in the classroom or online. No other position within healthcare has so much interaction with other healthcare professionals. Health Unit Coordinating provides an excellent foundation on which to develop because of all of the variety of duties and networking opportunities. Working as a Health Unit Coordinator can provide training and experience to develop the necessary skills to take advantage of other careers within healthcare. Interpersonal communication, organization, time management, computer proficiency, customer service, critical thinking and problem solving, and strong teamwork skills are transferable and essential to all healthcare careers.
As certified health unit coordinators, we are here for the staff.
We are here for the nurses. We are here for the visitors. We are here for the providers. We are here for phlebotomy. We are here for physical medicine. We are here for rehab. We are here for endoscopy. We are here for spiritual care. We are here for radiology. We are here for family. We are here for respiratory. We are here for response. We are here for oral routines. We are here for schedulers. We are here for nurse practitioners. We are here for nurse assistants. We are here for telemetry. We are here for IT. We are here for housekeeping. We are here for EKG. We are here for case management. We are here for social work. And we are here for the patients.
Hello everyone, my name is Jada Russo. I am a licensed mental health counselor in the state of Florida and also a clinical supervisor at a private practice here in Tallahassee, Florida. So a little bit about me. I graduated from FSU with my master's and education specialist degrees in clinical mental health counseling. That was one of the only programs in Florida, I believe, that offered a dual degree program. So I was able to finish with 2 degrees, totaling my degree count to 3. So that was a really fun experience for me. Before that, I attended USF, or University of South Florida, in Tampa, Florida, and I was a student athlete there. I ran track for 3 years and finished up with my bachelor's in interdisciplinary social sciences with a concentrations in Africana studies and behavioral health care. So that's a little bit about my education. Typically, a day of work, what that looks like for me. I wake up, do my routine, everything, get to work. I kind of handle the day-to-day operations of the private practice that my supervisor or the CEO of the private practice is a little too busy to handle. I currently supervise 3 clinicians or therapists who were once in the position that I was in, trying to get their clinical hours to become licensed. I sign off on notes, I meet with them, we discuss cases, they kind of come to me. I'm their point person if they have an issue before they go to my supervisor or the CEO of the organization. So it's a really fun job. At the end of the day, I get to help people, and that's really, my motto in doing what I do. I feel that, if my career were to end tomorrow for whatever reason and I had only helped one person, I think that's enough. I pride myself on ensuring that clients feel better leaving my office than when they walked in. Really just being that safe space for people to make sure that their mental health is okay. As far as my experience in this field, I have been doing this since 2019. I believe that was my first job. I kind of worked my way up in this field. I started as a BHT or behavioral health technician at a homeless shelter. I transitioned to become a case manager and then a clinician. Went to school, got my degrees, finished my clinical hours, did the training, took the licensure exam for the state of Florida, and was able to pass that on my first try, fortunately. So everything was pretty back-to-back, regimented, got to get it done with me as far as my career. In that time span, I have had experience working with children, working with adults, young adults, older adults, working in elementary schools, working in homeless shelters, working in private practices, and working in the foster care system. So kind of a lot of experience in a lot of different places, and I think that really helps me show up as an ethical and good clinician for people that I desire to help in this field. So kind of some advice for you guys. I think that the biggest thing for me, I know this is a cliche saying, but it's not about what you know, it's about who you know. I was able to work my way up to become clinical supervisor at a place I was once interning a few years before. So really having someone that takes you under their wing to show you what they know so you can kind of grow, not even in a professional sense, but as a personal aspect, I think that's a great thing. Also, another cliche saying, but incredibly true, I wake up every day and I don't let my reality shape my dreams. I think your dreams should shape your reality. As long as you work hard, as long as you believe in yourself, as long as you give yourself grace and patience and understanding that we're human, we mess up, we're not perfect, but being kind in the process and ensuring that you do the right thing, I think that goes a long way. So yeah, that's a little bit about me and a little bit about my career. I hope you guys could get some information from this, and I have influenced some future counselors. So yeah, thank you.
A cardiovascular technologist is a specialized healthcare professional who scrubs in with cardiologists to assist with procedures in the cardiac catheterization lab. They also record information during the procedure, which can be used to calculate the size of heart valves, find holes in the heart, and determine how well the heart is pumping. All of this data helps the physician diagnose and treat the patient. A cardiac catheterization lab, or cath lab for short, is where patients go to have imaging performed on their coronary arteries. A number of interventional procedures are also performed there, including balloon angioplasty and stent placement. Coronary angiography is the type of imaging we do in the cath lab, and it is invasive imaging because we inject contrast through catheters that are inserted into the heart through arteries in the wrist or groin. A fluoroscopy machine is moved around the patient to record video images of the arteries, now visible because of the contrast. Everything we do goes through a catheter, so there's no need for large incisions like in surgery. A typical day in the cath lab starts around 7 a.m. with our scheduled procedures for the day. It's not uncommon for urgent and emergent patients to get added on, so we might work past our 10 or 12-hour shift. When there is an emergency after hours, such as someone having a heart attack, they call 911. EMS responds, contacts the hospital, and the cath lab team members who are on call for that time are called in. We work together quickly to find the blocked artery and open it, usually with a stent. It's important for a cardiovascular technologist to think critically under pressure and have a high attention to detail in things such as maintaining the sterile field. They should enjoy a fast-paced environment where there are new challenges every day and be excited to learn and use rapidly evolving technology. When someone comes in with a heart attack and you're able to help get that stent deployed and resolve their chest pain, you're reminded how awesome it is to have one of the few jobs with instant gratification.
Hi everyone, my name is Austin and I am a board-certified physician assistant or physician associate depending on the state that you practice. I currently work in the critical care setting and I do a little bit in the outpatient setting as well, primary care, but my primary job is within critical care medicine. So typically within the critical care setting for a PA, we manage, diagnose, and treat illnesses ranging anywhere from dermatological to respiratory to neurological emergencies. And within this field of medicine is a very high pace and can be very stressful, but also very rewarding. So typically we manage and treat and collaborate not only with our physician that we work with, but also pharmacy, nursing, dietary, therapies ranging from occupational to physical to speech language pathologists to even music depending on the patient's need. So primarily to get into PA school, typically most people follow some kind of medical bachelor's degree, 4 years at an undergrad institution. However, this is not required. It's basically just that you meet the prerequisites for applying to PA school. I have worked and went to school with colleagues that were not, healthcare focused in their bachelor's, however, still pursued a career as a PA. After this, you attained anywhere from 200 to 4,000 clinical hours to allow you to apply to PA school, and depending on their program, they ask that you take some kind of graduate level exam, either being the GRE or the PA CAT. Once accepted, you then would complete anywhere from a 24 to 32 to even 36, depending on that program's length of time to become a PA. During that time, typically the first year is didactic, meaning book work, learning how to treat, diagnose, and perform exams. And then the second half, known as the clinical aspect, you would then, this is where your time to learn, rotate, and practice under, preceptors. Being a PA within the critical care setting is very rewarding, and highly recommend to anyone that is interested in a high-paced environment and helping people within that acute setting. Typically within the ICU, like I said, we diagnose, treat illnesses. However, we do a lot of bedside procedures, ranging anywhere from endotracheal intubation to chest tubes to lumbar punctures, arterial lines, central line placements, because in the acute setting, certain things have to be done emergently, which might require to be done at bedside rather than being done in a more calm place like the OR setting. I highly recommend the PA route. I am very pleased with my choice in this profession, and is a very rewarding, especially within the critical care realm. If there is anything we can do to help and promote this profession, or be a resource to anyone willing to pursue the PA route. I'm more than happy to be a guide as well as support for those willing to become a physician assistant or physician associate. I wish you all the best of luck, and thank you.
Good afternoon, everyone. Today we're going to be speaking with Janine Carrero. She's going to talk to you a little bit about a career as a dental assistant. So Janine, if you want to go ahead and tell us a little bit about yourself.
Yes, hi. So I've been a dental assistant for about 40 years. I'm actually an educator. I'm a dental assistant educator. I'm still in the field. I work evenings. I fill in on holidays, Saturdays, wherever I can. And it's best because I have that experience with the upcoming technology, new materials in dentistry. So I keep my hands in it, and it is an asset to my students when I do that.
Wonderful. And so can you tell us a brief overview of a profession as a dental assistant and what that and what your primary responsibilities are?
So being a dental assistant is so rewarding. Our primary responsibility is patient care. Our patients are so important to us. We become so close to our patients, but also providing the second set of hands for the dentist. We are the main support to the dentist. They call that four-handed dentistry. So it's the two hands of the dentist and the two hands of the dental assistant. So our other responsibilities are sterilization, sterilizing all the instruments, disinfecting all the equipment, taking dental x-rays, and then we can expand to specialty practices where we're actually working in an orthodontic office and oral surgery, periosurgery, endodontics. So it's unlimited. And also there's so many dental assistants that branch out to become lab technicians. Also, a lot of dental assistants branch out and become administrative assistants. So they're working at the business office, the front desk. We don't call them receptionists anymore. There's so many, because it's so wide open as far as the responsibilities at the front desk. So they're administrative assistants, and they're doing billing coordination, working with insurances, intake on patients. And it just is that's also unlimited as well.
Can you briefly describe the day-to-day work of a dental assistant?
Yes. So the day in the life of a dental assistant. So we're usually the first person that walks in that dental office. We turn on all the equipment, make sure that we have everything ready for the day. A lot of offices do a team huddle, so everyone shows up early. Hopefully the doctor brings in some goodies for us, and we sit around and just talk about our patients, because again, number one concern is our patient care. So what we do is we actually look at our schedule for the day, coordinate with the other assistants, the hygienist, the dentist, and we're all working as a team. So, and then we're ready to open up the door, whatever the time is, and welcome our patients.
So let's talk a little bit about how to become a dental assistant.
Okay.
So what educational background and training are typically required to become a dental assistant? And are there specific certifications or licenses that the professions in your field often use or pursue to enhance their qualification?
Every state has different requirements. So depending on the state you're living in. So I teach high school. So in Massachusetts, there's a lot of vocational high schools. So our career and tech high schools in the comprehensive arena. So what it is if you're at a vocational high school, it's 4 years, and you're going throughout the 4 years in dental assisting training. There also are comprehensive high schools that have, limited training, but it's still enough training to go out there. And then you can have on the job training as well. A lot of dentists do like to have trained dental assistants. There are post-secondary programs as well that are great. After high school, you could enter into a post-secondary program. But a lot of dentists do like to have the trained assistants because they don't have time in their day to train. So it is, and also you're getting a lot of that infection control training, which is required for the states. And then your x-ray, your radiation, health and safety training as well. So as far as certifications, there are national board certifications that have your infection control, your radiation health and safety, and your general chair side. That is the dental assisting national boards, DMB. But state by state, there are also licensing by the Board of Registration in Dentistry in that state. So again, it is by state by state.
And so can you give us a little bit of insight into what the typical salary or salary range would be for a dental assistant?
So their national annual salary is $45,000 a year. So some of the states are like Louisiana and Arkansas are like $16 an hour. Alaska and Massachusetts have one of the highest. It's $25 an hour on average. But there is a huge need for dental assistants right now, and the demand is high for dental assistants. So the increase in salary has become, comparable to other health occupations.
Thank you so much for joining us here, Janine, and letting us know all about what a career in dental assisting can look like. So
thank you so much.
Like, summer was all right until right about when school was about to start. I developed some kind of sickness that seemed like it was the flu.
So I went to the doctor with Johnny, still had the headache, still had the fever, but all of a sudden we noticed that he had these little purple dots, almost like freckles. He wasn't too concerned, but the doctor still wanted him in to get a blood test and get a blood workup on Monday morning first thing. 1:30 in the afternoon, the doctor called and he said, "I've got some bad news." He said, "I think that your son has leukemia." He said, "I need you to go up to the peds ICU right away. They will be waiting for you." And that was just way too much to comprehend.
Then I heard this very urgent voice saying that, something's wrong with Johnny. He's at the hospital. It might be serious. We don't know exactly what's happening yet, but I'm going to pick you up right away.
Went up to the hospital, and that's really when the surreal part of this all started. I walked in with Deb standing with Dr. Mitchell and a priest, and Johnny was already up on the intensive care unit, and the priest was already offering last rites.
Johnny's case was really an interesting case as far as the laboratory is concerned. It all started with the phlebotomist at an outpatient draw site, and that phlebotomist drew the specimen. The specimen came into our Logic campus where the initial CBC was done and some of the initial chemistries. His case touched every single laboratory department, from hematology, chemistry, hemostasis, urinalysis, microbiology, blood bank, flow cytometry, cytogenetics, every single department, and many staff on all three shifts touched his specimens.
In Johnny's case, we would have seen a really elevated white blood cell count. We also would have seen the low platelet count, which together those are really indicative of a bad situation. Probably leukemia, but we wouldn't really know that till we did some other studies.
And in addition, our technologists were seeing blasts in his peripheral blood, which to us usually signals possibly acute leukemia. And so my first involvement with this patient was when I became aware that there was an abnormal blood smear on the patient. The patient's physician was called with those results, and the patient was eventually admitted actually the same day that he had those initial findings.
I met Dr. Mitchell, and she was trying to tell me what they were going to start with in order to find exactly what was wrong with him.
I explained a procedure called a bone marrow aspirate to them, and we transfused him with platelets because his platelet count was so low. We gave him vigorous IV hydration, intravenous hydration, because of the height of his white blood count was high enough to cause sludging, can cause problems with clotting or even stroke.
But it was so overwhelming that I just started to look away from her. And she just said, you know what, I need you to look at me right now, and you have to understand what's going on. You got to be strong for him.
The next morning we did a bone marrow aspirate and biopsy, and then that's analyzed in both pathology as well as flow cytometry and cytogenetics.
Well, this specimen that we got by reviewing the cases came in at 8 o'clock in the morning. I think by 9:30, the proteomics or the flow cytometry was already completed.
Dr. Pam Kidd, the hematopathologist, looked at that within an hour of doing the procedure and called me within 2 hours to say, this looks like acute myelogenous leukemia. It looks like that, but that's not confirmatory until we see flow cytometry of the bone marrow. So when we had the flow cytometry data back, I reviewed this with John's parents, discussed the treatment with chemotherapy for acute myelogenous leukemia, and discussed prognosis. That we had a fair chance of beating this, but it was a tough battle.
The diagnosis that we arrived at was acute myeloid leukemia. Now, there are different kinds of acute myeloid leukemia, and particularly in terms of treatment these days, it's very important to know what kind of acute myeloid leukemia. In his particular case, we identified acute promyelocytic leukemia. It had a particular cytogenetic abnormality called a translocation 1517.
So we were asked to perform the probe for translocation 1517, and when we did that, he had 96% of his cells abnormal. They did contain translocation 1517. So that confirmed the diagnosis.
I'll never forget, I mean, she just came flying into the room. Just big grin on her face. This Dr. Mitchell.
Her coat flying behind her.
And
I
she
mean,
said, stop everything. We got the lab results. We've got a type of cancer that we can treat with a very specific drug, but we know what it is now.
We need to use less chemotherapy in that setting, and so less toxicity. And unless you've walked that path as a patient or family or physician caring for these patients, limiting toxicity was a critical point in this patient. It really made a huge difference to have an accurate diagnosis.
This was like overnight, they had figured this out.
In all patients with acute leukemia, we follow them very closely. They usually receive a follow-up bone marrow examination on the 8th day of treatment, and then frequently on the 15th day of treatment, and then almost always on the 28th or 29th day of treatment, to see if they are in remission, whether their treatment for their leukemia is being effective.
What we do is we go specifically looking for these same cells, his disease cells, after 7 days that we had found out the first day. And then 7 days after that, we look for those cells again. I think that after 14 days, flow cytometrically, or from the flow cytometry lab, we did not see any more of the malignant cells. And also from that specimen, cytogenetics got part of that specimen, and then they were looking for the translocation, the 15 to 17 translocation, and to see if they could find any of these cells also. And so morphologically, when the pathologists get the slide, if they don't see what they're looking for, and you put all these three together, which I think is teamwork, then we're pretty sure that he's clear of the disease.
So we're able to offer great reassurance to John and his parents that he was still in remission and that we, expect him to remain in remission.
Johnny's case is really exciting for us because it's one example where we really know the significant impact we made and the outcome, and there are many, many more patients that laboratorians take care of across the country every single day that you don't get to find out what's happening with the patient.
It's interesting to me that I have the gratifying relationship with the patient, but I often tell families there are many unsung heroes, behind the scenes, really caring about this child and contributing to the care and the success of our treatment.
I really do feel like I'm making a difference in people's lives. I definitely feel it in those moments of crisis when people are standing, waiting for that result, and we can get that back to them, and we know that that has just changed the course of treatment for that patient.
Scientists, they saved our son, and I want to thank them. That I am so grateful for what they have done for him.
If I could meet the people that did all the lab work, I would be so incredibly grateful towards them. I literally owe my life to them.